You might have a scar from a fall, from something traumatic, or from surgery. If you have a scar that really bothers you on your face, Jasmine and I, my nurse, are amazing at handling those scars and flattening them, blurring them, making it a lot less noticeable to the human eye. Not all scars are created equal, but we have a lot of things in our tool belt to help scars look better. The first things you can do at home are pretty easy. Sun protection, something with silicone, and moisturizing. These things have been shown through multiple studies to help your scar heal better, look better with time. It's a lot harder if your scar is really old, but if it's an early scar or if it's maturing throughout that year, you can actually get a lot of benefit from things at home. But in-office procedures will take it to the absolute next level. It can blur that scar. The human eye is trained to isolate lines on the face. And so there's really nothing on your face that's a straight line. So if you're worried about the scar's thickness or how it looks, things that can make it look better are lasers, because it basically creates a blurring effect to that area, resurfaces them, flattens them. And I frequently use lasers in my practice for patients with scars either coming into my office or if there's a scar that they've had since surgery that's kind of bothering me. If you have scars that are bothering you, they're on your face, they're on your neck, they're on areas that bother you, give me a call. I'd love to see you in my office.